guys, let's learn about Kussmaul sign and Kussmaul breathing. And yes, they are both different things. So what is Kussmaul sign? Kussmaul sign is a paradoxical rise in JVP on inspiration. Now why it is paradoxical? Because in a normal individual, the JVP falls with inspiration due to reduced pressure in the expanding thoracic cavity. Now let's learn this through a diagram. Now, whenever we inspire, there is a negative intrathoracic pressure created, and because of that, there is expanding thoracic cavity, and because of that, the compliant heart accepts blood from jugular vein and gets filled during inspiration phase. Increased right ventricular filling, and because of that, there is reduced JVP or fall of jugular venous pressure. Now, in a pathological condition, when your heart is not compliant enough, like right ventricular failure, what happens is during inspiration, there is no expansion of intrathoracic cavity or right ventricular does not get filled. And because of that, the blood goes back. Because of the backflow of the blood, there is a raised JVP, which is in abnormal condition, right? Jugular vein is paradoxically full. Now, what are the conditions which we see Kussmaul sign? Constrictive pericarditis, right side heart failure, right ventricular infarction, or restrictive cardiomyopathy. So let's move forward to Kussmaul breathing. So Kussmaul breathing is a form of hyperventilation, which is any breathing pattern that reduces carbon dioxide in the blood due to increased rate or depth of respiration. So Kussmaul breathing is deep and has high respiratory rate, which is seen in metabolic acidosis. At the first stage, the breathing is rapid and shallow, but as acidosis worsens, breathing gradually becomes deep, labored, and gasping or air hunger. Kussmaul breathing is respiratory compensation for a metabolic acidosis, most commonly occurring in diabetics in diabetic ketoacidosis, which there will be fruity odor because of acetone. So this is eupneic or normal breathing pattern, which respiratory rate will be 14 to 20 respiration in a minute, which is not shallow or not deep, right? So Kussmaul breathing pattern, you can understand it through this graph, which is very deep or labored breathing. So the causes can be remembered by the name itself, Kussmaul. The first cause will be ketones due to diabetic ketoacidosis, uremia, sepsis, salicylates, methanol poisoning, aldehydes, or lactic acidosis.